let's put aside the patients who have bleeding problems because they're going to be in the reproductive age. But we're talking about our older patients. They're coming in, and sometimes things are falling out, and it's due to, like we talked about, the aborting fibroid. Things are coming out of them, and they're like, well, what's going on with me? So this is when we jump in. But a lot of women that are older, we don't do anything with the fibroids. We just leave them alone, and we can watch them. So if a woman is not having, symptoms, and they're just there, and they're not too big, and they're not growing, and it's just there, and they don't even know that it's there, and it's not bothering them, we won't do anything but continue to watch them.
Oh, that's
so we need to get that across, that you don't always need to, we gynecologists don't always intervene with medicine, procedures, or surgery for all patients with fibroids.
That's very interesting. So at least you would put the patient, make them aware.
Right.
That they have it. And like you said, sometimes there's no, you would by right, be like, hey, you are living with a fibroid, but there's nothing, no further action that needs to be done.
Right. Especially when they're not too big and they're very small. Like I said, up to 70-80% of women have fibroids, but we're not operating on 70-80%.
That's where I was confused.
Yeah. So we are, really focused in on the women in the reproductive age that have the bleeding problems, they have the fertility problems, they have the pain problems, and then you get some older women that just all their life they had this big thing going on, and they had all these symptoms but just never equated, or maybe never even gone to the gynecologist and didn't know about it. So we're able to tell them, listen, you have this tumor in your belly, you need to do something about it because we're not sure what's going on. It's too big. So if things are too big, we tend to jump in because we're worried about that possibility of sarcoma that we talked about. But if fibroids are just there and they're not really growing and they're just hanging out, not causing any problems, we leave them alone and we just watch them, make sure they're not doing anything.
That's really good to let people know that you can have life with fibroids.
Absolutely, yes.
Which I didn't know. 'Cause I've guessed that most of the people I've interacted with who've had them always had to have some sort of medical intervention done.
Right.
To either remove them or subside them. And we could continue this into the next segment as well, but just different types of treatment.
Yes.
So we talked about the surgery. Is there non-invasive?
Yeah, there's medical treatment, there's non-invasive treatment, and then the invasive treatment would be the surgery. So medical treatment can be, we have what we call either GnR agonists or injections that we give to patients. And what this medicine does is it helps shrink the fibroids. The problem with that particular medicine is after you stop the injections, and that can go on for maybe almost up to a year, the fibroids can grow back bigger. So that's not really always a good option. We use that option with patients who are bleeding and we may want to get their blood count up. We'll use those agents to help prior to surgery, to help, clamp down on the blood vessels so they don't bleed. Other medical treatment, which has been hot off the press in 2017, they have progesterone receptor modulator and agonists and antagonists. These are newer types of treatment. They hold more promise, for treatment, and they help also to devascularize or get the blood supply away from the fibroids, as well as to shrink the fibroids as well. So those are more promising.
Those are definitely good.
Yeah.
And I want to continue that. We're going to take a quick break. Next segment coming up, we're going to go into some more treatment. So guys, if you're suffering with this issue, you're definitely going to want to listen into this next segment. We'll be right back. Welcome back. You're watching Beyond Focus TV. I'm Lydia Patel, sitting with a resident doctor. You know, Beyond Focus resident doctor. Every couple of months we have you on giving us great information, and she is so versed in so many different topics. So it's great to actually have a staff doctor on board who could turn to and actually inform the viewers, and really, because this information that you're giving is top notch. So we're saying about some 2017 new medical treatments that actually came out. Have they been tested?
They've studies done, and they've actually proven to be better than the original GnRH agonist that we first talked about, the progesterone type. Fibroids have a hormonal component to it, and the hormonal component is estrogen and progesterone. This is why heavier women also may tend to have bigger fibroids, because in your fat you actually produce estrogen. So you can, give more life to a fibroid being heavier set, big body mass index, higher body mass index, I should say. And you can make the fibroids grow, just having more weight on you. So that's just one. The medical treatment is one area that we can treat patients, and we choose wisely. The other procedures that we need to talk about are non-invasive treatment. So a lot of myths are that you have to have surgery if you have fibroids. Well, we just talked about some medical treatments, and the other treatments that we need to discuss are the ones in which there are procedures done. These are called uterine artery embolization, one of them, and then the other one is magnetic resonance image-guided ultrasound surgery. I know that's a mouthful. But these are two different procedures. One has been around a very long time, which is the uterine artery embolization. That's a procedure in which you'll be able to do in one day. You go into an interventional radiologist does the procedure, so the gynecologist does not do this procedure. And you need to have an MRI before you go to an interventional radiologist. And what they do is they block the blood supply to the uterine artery where the fibroids are located. So they put these pellets in, and it causes the blood supply to just devascularize, or basically the fibroids lose their blood supply, so they basically die inside of you. So it shrinks fibroids maybe by 50%. So this procedure doesn't get rid of them, but if you're having pressure type symptoms and you're having, frequency going to the bathroom, those types of symptoms, and you're older and you don't want to go through a hysterectomy, and you don't want to, have, any kind of surgery, you can choose this procedure and see how this procedure does for you. Again, it's called uterine artery embolization, and it's done in a day. You won't have to be out for surgery. A lot of women are not choosing surgery because they have to work, and so it's nice to be able to offer patients a non-invasive procedure in which they don't have to lose much time from work, and they can get their symptoms improved. So that's one procedure. The other one is done with the MRI, or the magnetic resonance imaging, and they actually go to each fibroid, and what they do is they thermally burn the fibroids.
Wow.
It's a longer procedure than the embolization, but it actually gives a little better, less pain. The embolization can cause pain. One of the things that happens also with an embolization, the first procedure, is you can actually spit out your fibroid. So if you have a fibroid that's inside of you in the lining where we showed earlier, you can actually lose it. So that procedure will cause that. But the other one basically just heat burns the fibroid. So those are two non-invasive procedures that we need to let our viewers know are options. And they're, again, done by interventional radiologists.
And both of them done at your clinic.
Yeah, well, we refer for that. We
out.
refer for that. Yes, we refer, because we don't do
the surgical portion.
Now, the surgical, that's where we perform the ones that are needing surgery. And that's mostly in a lot of patients who, again, want pregnancy, because those procedures kind of cause injury to the uterus. Even though we do have patients having pregnancy after an embolization, it's not the optimum procedure to use if you are going to have babies. So the radiologist will tell you that. And it's not the best procedure for big fibroids either.
Got it.
So they have less effect when fibroids are really big, like my patient who had the 11 centimeter fibroid. Yeah.
That is,
Yeah.
and just to know that you were able to be instrumental in making that happen
Absolutely.
is
Yeah.
amazing. Where are you located? How could everyone get in contact with you?
We're located at 1020 North Broadway in Yonkers. We also have an office in Corre in the Bronx, 3050 Corre Avenue. And we're woman-to-woman OBGYN. You can look us up on our website, westchesterobgyn.com.
That's awesome. What's the best number if they want to call, maybe set up a consultation or come in for an appointment?
So it's 914-375-2800.
Okay, that is awesome. I mean, this segment has been so informative. Doctor, would you say that the number of women coming in with fibroids has increased over the years? Just some general information.
I would say, a good percentage of our women have fibroids. And, in our office, at least 75% of patients have fibroids. Not all of them have problems due to them, but we evaluate our patients based on their symptoms, and we do sonograms in our office, and we're able to tell women, listen, you have a small fibroid, you have a big fibroid, and we're able just to watch them. If they have no problems with it, we say, okay, as long as things don't grow, you're good. Yeah. And they'll enjoy coming in and making sure everything is. And those patients who, have a good size amount of fibroids, we say, well, you can come back in 6 months and we can reevaluate, make sure it's not growing. So we're able to offer all these services to our women.
I love it. We're going to have everything at the bottom of the screen so you can come out and check out Dr. Susan yourself. And Dr. Susan, thank you so much for being on the program. Yes, again. All right.
Thank
and as
you.
always, if you have any questions or comments, you can send us an email at info@beyondfocusmedia.com. I'm your host, Lydia Patel. Thank you so much for joining us. And we'll be back again next week. Same time, same place. You're watching Beyond Focus TV. Stay with us.
Beyond Focus TV show wants and needs your feedback. Did we blunder? Please let us know so we can improve. Was the show helpful to you? Drop us a note so we can share the success with our staff members. Is there something you think we could do better? We welcome new ideas and new approaches to old ideas. Do you have a great suggestion? Let us know and we'll work on it. If you would like to share your comments anonymously, please send us an email at info@beyondfocusmedia.com. If you want to get in touch with the executive producer directly, send him an email at jean@beyondfocusmedia.com. We really look forward to hearing from you.